The urgent truth: why minutes will decide everything. I've spent over 3 decades in the frantic, unforgiving environment of the emergency room, and I need you to hear me clearly. The truth about heart attacks, especially when you're over 60 and alone, is brutal but unavoidable. Most people in that age group will not survive their first major cardiac event if they don't have help right beside them. This isn't fear-mongering, it's a stark, evidence-backed fact. Nearly half of all heart attack deaths occur before the patient ever makes it through the hospital doors. And the reason is shockingly simple. They waste time. They hesitate. They panic. Or worst of all, they simply don't know the few, basic, life-saving actions that can keep essential blood flowing long enough for the paramedics to arrive. If you don't possess this knowledge, that crushing pain could mean you are gone in minutes. Every single day, I have witnessed patients brought into my ER who could have walked out alive had they only done 1 or 2 simple things differently at home: a crushing pain in the chest, sudden breathlessness, an eerie cold sweat, and by the time they get to us, that critical golden window for treatment has slammed shut. But here is the good news the secret cardiologists share with their own families. There are science-backed techniques, simple self-actions you can perform right now, completely alone, that can dramatically double your odds of survival. These are not gimmicks or myths, but proven strategies. In this essential guide, I'm going to walk you through 7 absolutely critical steps every senior must master to survive a heart attack when nobody else is around. Starting with the very first action that is most likely to save your life. The golden rule of time: call emergency services immediately. Tip number 7. The very first, most non-negotiable step when those crushing, unmistakable signs of a heart attack begin is to call emergency services without a single second of hesitation. Do not wait for symptoms to pass. Do not second guess whether it's just indigestion, and do not tell yourself you can tough it out. This delay is the single greatest killer. Cardiologists have a mantra: time is muscle. Every minute that blood flow remains blocked, more heart cells die, and your chance of a full recovery or even survival plummets. Research from organizations like the American Heart Association confirms this. Patients who call for help within the first 5 to 10 minutes of symptoms enjoy survival odds up to 50% higher compared to those who tragically delay. Yet studies show nearly a third of people over 60 wait more than 2 hours, often because they don't want to cause a fuss. Consider the tragic case of a 68-year-old grandfather who felt pressure in his chest, told himself it was heartburn, drank some water, and waited for hours. By the time his daughter found him and called 911, the damage was irreversible. Doctors confirmed that an immediate call would likely have saved him with minimal heart damage. If you're over 60 and feel crushing pressure, sudden breathlessness, or cold sweat, you must act as if it is a heart attack until proven otherwise. Pick up the phone and dial emergency services. Even if it turns out to be nothing, you've lost nothing. But if it is a heart attack, you've just taken the single most important action to buy yourself time. The immediate lifeline: chew an aspirin. Tip number 6. Once you've made that critical call to emergency services, the next move can immediately start fighting the attack from the inside. Chewing an aspirin, provided you are not allergic or advised against it by a doctor. It is absolutely crucial to chew the aspirin, not swallow it whole. Aspirin is far more than a simple pain reliever. It is one of the most powerful, over-the-counter, clot-fighting drugs available. A heart attack is most often caused when a blood clot blocks the flow of oxygen-rich blood to the heart muscle. Aspirin works by thinning the blood and stopping that clot from growing larger, which can maintain just enough circulation until professional help arrives. The science is definitive. A landmark study published in The Lancet demonstrated that taking aspirin during a heart attack reduced the risk of death by a significant 23%. However, the speed of delivery matters immensely. Swallowing a whole pill means waiting 10 to 12 minutes for it to break down in the stomach. Chewing it breaks the tablet apart instantly, allowing the active ingredients to absorb through the lining of your mouth and stomach in a matter of minutes. For example, one 70-year-old retired bus driver alone at home felt the crushing chest pressure, remembered his doctor's advice, and chewed an aspirin while dialing 911. Paramedics later credited that simple, fast action with preventing major heart damage. He walked out of the hospital 2 weeks later, alive and independent. Doctors usually recommend chewing one full 325 now uncoated tablet at the first sign of an attack, thinking of it as sending in a rescue team to slow the disaster until the reinforcements arrive. Optimizing your position. Loosen clothing and sit upright. Tip number 5. When a heart attack strikes, every movement and position you take affects the sheer amount of strain your struggling heart must endure. Therefore, one of the simplest, yet most overlooked survival actions is to loosen all tight clothing and sit upright. Seniors often fail to realize how quickly restricted circulation and poor posture can compound a bad situation. Tight belts, waistbands, or collars can restrict major blood vessels, making it harder for your body to circulate oxygen-rich blood when it is needed most. More importantly, sitting upright relieves pressure on the diaphragm and lungs, making breathing easier and reducing the physical workload on your already desperate heart. This is based on sound physiology. Lying flat, especially in seniors with weaker lungs, forces the heart to pump harder. By sitting upright, preferably slightly angled with good back support, you improve airflow, lower internal chest pressure, and allow blood to flow more effectively. A review in the European Heart Journal emphasized that positioning patients upright during a cardiac emergency helps reduce pulmonary congestion, the fluid buildup in the lungs that causes that terrifying feeling of suffocation. The way you sit can literally mean the difference between gasping for air and keeping calm enough to survive. We've seen cases such as a 74-year-old woman who, feeling pressure while gardening, immediately moved to a chair, loosened her apron, and sat upright. Her doctor confirmed that decision likely prevented her from fainting and collapsing before the ambulance arrived. It's a tiny physical adjustment, but it buys you precious stability. The powerful physical action. Cough strongly if you feel faint. Tip number 4. It sounds strange, almost too simple to be true, but in the middle of a heart attack, forceful, deep coughing, what some doctors have called cough CPR, can sometimes keep you conscious long enough for professional help to arrive. The principle is straightforward. When you cough deeply and forcefully, your chest muscles contract, the diaphragm compresses, and pressure builds rapidly inside your chest. That sudden pressure briefly forces blood out of the heart and into the brain, sustaining consciousness when circulation is on the verge of collapsing. While it is absolutely not a substitute for emergency medical treatment, it is a crucial stopgap if you suddenly feel faint, dizzy, or on the verge of passing out before the paramedics walk through the door. Research published in the Journal of the American College of Cardiology showed that repeated, strong coughing during certain cardiac arrhythmias kept patients conscious and maintained temporary blood pressure until definitive treatment could be administered. Imagine a 69-year-old retired mechanic in his workshop feeling that sudden, terrifying wave of dizziness during a massive attack. He remembered hearing about this technique, began coughing forcefully every few seconds, and stayed conscious until help arrived. Doctors later stated that those repeated coughs likely prevented him from collapsing and suffering debilitating brain damage. If you ever feel your vision narrowing, your head spinning, or your body going limp during chest pain, take a deep breath and then cough as hard and strong as if you are trying to clear your lungs of smoke, repeating the process every 2 to 3 seconds. It's like manually keeping your heart in motion when it is struggling to beat on its own. Clearing the path, unlock the door, and keep your phone near. Tip number 3. In a heart attack, every single second is precious, not only for your body, but for the people who are trying desperately to save your life. One of the most overlooked, yet simplest, survival steps you can take after calling for help is to unlock your front door and keep your phone literally within arm's reach. This may sound like a minor detail, but in a crisis, it means the difference between being found in time or being trapped behind a locked barrier while irreplaceable minutes slip away. Paramedics are trained to break down doors, of course, but every extra barrier costs time, and studies show that for every 10 minutes of delay in receiving treatment, survival rates drop by nearly 10%. Imagine losing those life-saving moments just because the rescue team couldn't get to you fast enough. We've seen tragic outcomes, such as a 73-year-old widower who called 911 but collapsed before he could unlock his door. Paramedics wasted precious time forcing entry, and too much damage had already occurred. Contrast that with an 80-year-old woman who unlocked her door, stayed in a chair near the entryway with her phone on speaker, and was reached immediately, surviving with only minor damage. The second half of this tip is just as critical. Always keep your phone nearby. During a heart attack, even walking a few steps to a charger or another room can cause immediate collapse. Having your phone next to you ensures you can stay connected with emergency responders, following their instructions without having to move a muscle. Your phone is your lifeline, and your unlocked door is the bridge that gets help to you faster. The counterattack on panic, slow deep breaths, tip number 2. In the middle of a heart attack, panic is arguably your worst enemy. When fear takes over, your body throws itself into fight or flight mode, releasing a flood of damaging stress hormones like adrenaline. This adrenaline spikes your heart rate and blood pressure, forcing your already struggling heart to work even harder and demand more oxygen. That's why one of the simplest yet most profoundly effective survival actions is to take slow, deep, controlled breaths. This controlled breathing does two critical things. First, it immediately increases the amount of oxygen reaching your desperate blood and brain, which are starving for fuel when circulation is limited. Second, and just as important, it deliberately signals your nervous system to calm down, lowering that surge of dangerous stress hormones that accelerate the damage. Research has repeatedly shown that slow, controlled breathing reduces heart rate and improves oxygen delivery, even in patients suffering from acute cardiovascular distress. It's not a cure, but it gives your body a fighting chance. A 76-year-old retired nurse survived her heart attack by resisting the urge to panic, sitting upright, closing her eyes and inhaling slowly through her nose, then exhaling even slower through her pursed lips. Her cardiologist later confirmed that those steady breaths reduced the workload on her heart and kept oxygen moving to her brain long enough for the team to arrive. If you find yourself in danger, place a hand on your stomach, inhale deeply through your nose, feeling your belly rise, and exhale gently through pursed lips, aiming for a slow, deliberate pace. Each deep breath is you actively buying yourself more time for oxygen to reach your brain and for your heart to ease its workload. The ultimate survival strategy: stay calm and still. Tip number 1. When a heart attack strikes, your first instinct to pace, move, or walk it off can be deadly. The number one most critical rule, the action that research shows can double your odds of survival, is this: stay as calm and still as possible. Every single step, every sudden movement forces your already weakened heart to pump exponentially harder. By keeping your body absolutely still and maintaining calm, you drastically reduce the overall strain, conserve every precious ounce of available oxygen, and give yourself the absolute best chance of surviving until professional help arrives. Science proves this unequivocally. Movement during a heart attack demands more oxygen from the heart muscle, but with the oxygen supply already severely cut off by the clot, that extra demand only increases the extent of the damage. Clinical studies have consistently found that minimizing any form of exertion during an acute coronary episode reduces complications and dramatically improves outcomes. In plain terms, seniors who stayed calm and still during the initial moments of an attack consistently lived longer than those who panicked and moved around. A 71-year-old farmer who felt crushing chest pressure while repairing equipment resisted his instinct to climb a ladder to grab his phone. Instead, he called for help from where he was and forced himself to remain still. Paramedics later told him that remaining still was the decision that kept his heart from collapsing under the stress. Calmness is physical, but it is also mental. Tell yourself, I have called for help. My only job now is to stay still and breathe. This simple mindset prevents you from making rash decisions like trying to walk to the door or grab something across the room, actions that can trigger immediate collapse. Think of your heart during an attack like a fragile engine running on fumes. Stillness, calmness, and conserving every ounce of energy is the ultimate key to buying that precious, life-saving time. Do less, breathe more, and let help reach you. Together, these 7 steps form a complete survival map that is your ultimate defense when a heart attack strikes.